On this exam, we're going to go over the abdominal exam. Again, these are focus exams that we're doing. And again, we just kind of look to see if there's any type of abnormality, if the abdominal wall has any type of surgical scars, if there are any type of discoloration that we can see. And any type of discoloration, meaning sometimes in the diabetic case, because they're doing self-injections of insulin, you may see areas that look ecchymotic, and there are areas that seem to have the tissue is at slightly different times of healing. So it may be kind of darker blue here, ecchymotic, and slightly yellow here. And this side looks a little on the less slightly yellow as they move around to give themselves injections. It is much easier to give a subcutaneous injection around the abdomen, and they tend to keep it all in one spot until that area is a lot way too tender, and then they'll move around. Now there are also insulin pumps, so there may be some on the back as we check for the abdominal wall. We'll be checking the entire abdomen. Again, it's broken up into our 4 quadrants. It can be even delineated even more as we go to the hypochondrial region, hypogastric, and then we have this sides and laterals and the suprapubic and so forth. But we're gonna just pay attention to here, just majorly 4 quadrants that you can figure. And keep in mind as you palpate the different organ structures that line with or lay within these 4 quadrants. We would start by looking, and after that we go ahead and listen so that when we start palpating, we don't create any type of abnormal examination findings. Go ahead and listen, and you can take your time to listen throughout more than just 4 quadrants. Take your time to listen. We can compare right to left, but basically just listening to see if you have these type of gastric sounds. Gastric sounds should be a little higher, or in frequency should be a lot more higher, increased number, somewhere over this epigastrium area where the stomach lays, and as you move around, it may be slightly less as it moves down through the small intestines, kind of in this region, and then we know that the large intestines roam around, going up from the ascending, transverse, and descending larger intestines. Particular note, so we're gonna listen, and then we're gonna then palpate the abdominal areas. Again, one hand just is tactile, just to feel sensation, and this one, the top hand would be your pressure. So we press and test, and then feel around under in that quadrant. We move up, noticing and watching the facial expression of our patient as we move around from the quadrants and palpating these regions, particularly to see if they elicit any type of tenderness, and they respond and tell us that there's any pain. As we came down the abdomen, we may also look for any type of pulsatile mass, and this may be running along the midline here of the patient's abdomen, just slightly, I would say, left lateral of the umbilical line for the aorta. Now again, you could run right down midline and a little bit maybe to the left of midline. So we're trying to see if we can feel and mark out the aorta. If we feel that upper quadrant here in the right, we can feel underneath the rib cage if they take a deep breath, and as the diaphragm goes down, it may push down the liver, so we may actually feel the liver bump into our fingers. Or if the gallbladder is inflamed, as they take a deep breath, they stop breathing, or will have inspiratory arrest where it stops because the gallbladder is irritated, and our hand down there pushing pressure will cause them to stop inhaling and try to take an exhale real quickly and say that was a very uncomfortable, and it caused a lot of discomfort to them. Now, as we move across to the spleen, you may end up feeling the spleen in cases like mononucleosis, or the spleen is enlarged. As we come down to the lower right quadrant, this is where we would feel for the appendix. Usually we would start with some type of periumbilical, but end down here in the McBurney's point in the lower right quadrant, and so we can palpate there. Uh, there may be other findings, as we know that there are large intestines and small intestines, and these guys all have different descriptions of pain as we palpate. Again, we're gonna sit them up for an abdominal exam. Even though it's abdominal, we're trying to test the cavity and then the contents within this cavity. We sit them upright so that we can test the flank area of their back. So we lift up the shirt and look for the hypochondrial, the costovertebral angle actually. So it's the midline here where the ribs meet the spinal column, and just underneath that V shape that you would see from the spine line and the rib cage by thumb. In this particular area, you place your hand flat, and then as your hand is flat over that area, you would gently tap the back of your hand to see if that would cause any type of discomfort or wincing of the patient. So again, they're sitting upright, and then you find that area and you gently tap on that area to see if it elicits any pain. Other tests, we can go ahead and tap the soles of the feet to see if that energy wave will cause any type of peritoneal type of response, where we have the lining that's very irritable. It may cause some pain there. We can also, for this right lower quadrant, when we bring the knee up and rotate it outwards, it may cause findings for a appendix. And then if we go ahead and just kind of lift that up, we're stretching these muscles here, and again, that could elicit some type of pain there in the lower right quadrant, identifying potentially maybe that's an